Health Topics Tuesday once again this morning with SVI Media and Star Valley Medical Center. And we're talking about sleep today. Hudson England with the Sleep Lab at Star Valley Medical Center is with us today. Hudson, tell us first off just a little bit about what you do and what I guess your official title is.
All right. My official title is a RPSGT, which is a registered sleep tech. This is our 10th year anniversary this year. We've been here in Star Valley for 10 years running the lab. We never run out of patients. Patients always have a problem with sleep and with sleep apnea. So the lab, we're really lucky to have a lab here at the hospital. The hospital has a lot of foresight in wanting to establish it here, because at this elevation there's a large number of people that have sleep apnea. And sleep apnea is an obstruction in the airway. So when we're awake and our brain's awake, we're breathing fine and there's no problem. But at night, when we go to sleep and lay down, then everything changes because our brain goes to sleep and so do our muscles. And this can happen to patients as young as, premature babies, all the way up to 95, 105. So it's a problem that's, we see patients here at this lab from 8 years old and older. And the majority of our patients are over 40 because that's when the problem usually becomes more severe here at this elevation. So once the patient or the spouse usually identifies a problem with loud snoring or excessive daytime sleepiness, that's usually the biggest two symptoms. Then the patient is referred to a doctor, and the doctor, if he feels a patient may have sleep apnea, refers the patient to me, and then I take it from there. Schedule the patient, have him come in, hook him up with 28 electrodes, and it's not as bad as it may seem. Most patients, when they come in, say, well, how am I going to sleep with all that on? But after I get them hooked up, they're pretty tired, and they're usually tired anyway from lack of sleep with sleep apnea when they have the problem. So I hook them up and have them come in at 9 o'clock at night, get them to bed about 10, and then I monitor them through the night. The electrodes are plugged into a head box, we call it, that is an amplifier, amplifies digital signals that I see on my computer. And by monitoring these signals, we can diagnose the patient, whether or not they have a breathing disorder. So they call it a sleep lab, but in my opinion, they should call it a breathing lab or an oxygen lab, because it's not really the sleep that we fix the sleep as a byproduct, but what we're trying to fix is deprivation of oxygen through sleep apnea. When a patient breathes during the sleep, they're not getting the oxygen they need because their airway closes off. And unfortunately, there's no pain with this problem. If there were pain, I'd have a ton of patients. But a lot of patients just ignore it because there is no pain and they're just tired during the day and they just say, well, I'm just getting older. But the problem is that it affects the brain and the heart in a major way over time. So a patient that has sleep apnea can have high blood pressure, heart arrhythmias, heart attack, and death over time. At least it's high risk for that. And also brain stroke, because they're not getting the oxygen that their organs need. And every night when they go to bed, their oxygen will drop. Normal is 90% saturation. It may drop down to 80s, 70s, 60s, and this happens every night. And over time, that's going to kill cells. So it's a very important study, very important to determine whether or not you have sleep apnea, because it's easy to fix. It's all natural. There's no immunizations. There's no drugs. All the patient does after we diagnose them is come in for a CPAP study. And CPAP, by the way, is an acronym that stands for continuous positive airway pressure. And we put a mask on their face. And this is one of the machines and one of the masks. They're very small, or can be. And the machines are very small, as you can see. And this machine draws room air and runs it through a hose into the mask through the patient's airway. And by running, it's a pneumatic splint is what it is, an airway in the airway, so the airway can't collapse when they go to sleep and their brain goes to sleep. And then with this CPAP, they can breathe normal. And usually they don't need oxygen supplement, they just need CPAP to open the airway. Then they get the normal amount of air in their lungs, and then their oxygen saturation goes above 90. So it's, and then all they need to do is wear it every night. And it's a all natural way of curing the problem. And it's patients that have the study, they'll say, why have I waited so long to do this? Because they feel so much better, they have energy, their oxygen in their body during the night is getting at the level where their organs need it. And with CPAP, they're like they don't have the problem at all.
Well, Hudson, you are a one-question wonder. I think you about took care of it all right there. Just real briefly here, so if someone's out there and they think maybe they do need to come and get checked out, what are some of the signs they should be looking for? And they just go to their normal doctor to get the process started?
Yeah, a lot of times it's the spouse that has to see the problem because we don't know we're snoring, and our spouse does. And so most of our patients realize they have a problem because their spouse tells them there's a problem. The signs are snoring and waking up at night during the sleep, inability to maintain sleep, and another big one is excessive daytime sleepiness, falling asleep at the desk or driving or whatever, and that's a big problem. When the spouse or the patient identifies that there may be a problem with sleep apnea, then they should see their physician. Their physician can look at their airway and listen to their sleep complaints and decide whether or not it's appropriate to have a sleep study, and then they refer the patient to me.
Very good. That's Hudson England with Star Valley Medical Center at the Sleep Lab with the SVI Media.